Let's look at the situation in the region. Before he died in March this year, former Tanzanian President John Pombe Magufuli had been widely criticized for his handling of the COVID-19 pandemic. But since she took power just over a month ago, his successor, Samia Suluhu Hassan, who's expected in the country, has signaled a shift to a science-based approach to COVID-19. Victor Kiprop reports on Tanzania's complicated fight against COVID-19 and why science is finally winning.
When Tanzania's new president Samia Suluhu Hassan directed the formation of a national COVID-19 task force 2 weeks ago, many believed that Tanzania was indeed coming out of isolation and taking a new direction in the fight against COVID-19. But is Tanzania actually resetting its clock on COVID-19? Let's cross the border and see how things look on the other side. As we entered the country through the Namanga one-stop border post manned by Tanzanian immigration officials, one thing became immediately clear. The country's response against COVID-19 was complicated. Although hand-washing stations had been set up outside, visitors were free to walk in without masks or even washing their hands. Inside, the officials also wore no masks and did not check our temperature readings, but insisted that we should have negative COVID-19 test certificates. In Arusha and other cities, the streets were busy and full of activity. There were hardly any masks in sight. Some restaurants and establishments required their guests to sanitize before entering their premises, but for the majority, it's really up to you.
Anapokuletea mtu barakoa hujui hata ameitoa wapi, kataa. Like
many countries in the region, Tanzania was initially quite prepared to fight COVID-19, but the late President John Pombe Magufuli's skepticism of the deadly virus left the country isolated in the global fight against COVID-19. Magufuli's regime downplayed the severity of the pandemic, questioned the safety and efficacy of vaccines, and criminalized COVID-19-related speech or information sharing. It was no surprise then when Dr. Shadrack Mwaibambe, the new president of the Medical Association of Tanzania, said he would not comment on COVID-19 until the country's new president has given the way forward, adding, and I quote, "It's your right moment to pursue a couple of stories, but it's not the right moment for me to be part of it. If you can't wait, as I said, I'm sorry," end of quote. In April last year, Tanzania stopped publishing COVID-19 data, and a month later, Magufuli announced that the country had defeated COVID-19 through prayers. His successor, President Samia Suluhu Hassan, however, appears keen to steer the country on a different path and has already set up a national task force to evaluate the threat of COVID-19 and advise the government on the way forward.
Wakati tukisubiri majibu ya kazi inayofanywa na kamati iliyoundwa, napenda kutumia fursa hii kutoa wito kwa Watanzania kuendelea kuchukua tahadhari zote zinazoshauriwa na wataalamu.
I think what she's concerned about is how to handle this pandemic economically. She didn't want a lockdown. What I understood is she wants to take the scientific approach, but economically, she wants to take an approach that is consistent with our particular condition.
On Friday, the country began installing medical oxygen production plants in its biggest national hospitals amid increased demand by patients with COVID-19. In the meantime, the country has not yet resumed publishing COVID-19 data, meaning it's hard to tell whether transmission is low, high, or has been stopped. Victor Kiprop, NTV.